Good afternoon, everybody. I'm Sayukta from beautiful Spotless Skin team. And I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face. They look like freckles, like spots forming large black patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India. According to study conducted across 4 Indian cities reveals that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women 90% and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation, generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this very common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hazards and to keep you informed, today we are here to know about sunscreen and melasma from an expert. So let's connect today with our skin expert, Dr. Keerthi, live from Bangalore to talk on sunscreen, an integral part in the treatment of melasma and hyperpigmentation. Dr. Keerthi Velugotla completed her MBBS from AMC in Andhra Pradesh and did her postgraduate diploma in dermatology, DDVL, from the prestigious Andhra Medical College in Visakhapatnam. She has over 8 years of experience in dermatology and cosmetology and has expertise in diagnosing and treating various dermatological disorders, venereological diseases, and leprosy. She is well versed with aesthetic procedures with good experience in procedures such as lasers, chemical peels, anti-hair loss treatments such as PRP, advanced procedures such as Botox and fillers. She has special interest in treating post-acne and post-traumatic scar treatment, PRP, PRF injections, treatment of pigmentation disorders. She has presented and co-authored several papers in national and international journals and also co-authored chapter in textbooks. She is a lifetime member of IADVL. It's such a pleasure to have you with us, Doctor. A very warm welcome to you.
Thank you. Thank you so much.
So, Doctor, first of all, let's start with what is melasma and hyperpigmentation for our viewers.
Sure. So melasma is basically a hyperpigmentary disorder. So it is characterized by a person having brown patches or hyperpigmentation patches, especially on the face. It starts basically on cheeks or nose and can spread later to your forehead, mouth, or around the jawline areas. So melasma basically is your melanocytes being very hyperactive on the skin, and it starts producing too much melanin all of a sudden. So this is one of the hyperpigmented disorders that is very common in our day-to-day practice.
Right. So we can say that hyperpigmentation is a broader term. It's an umbrella term, and melasma comes under it. Right. Now, melasma and hyperpigmentary disorders are so common in our society. Specifically, if we talk about melasma, it's so common in women again. What are the causes, doctor, of melasma?
So the exact causes of melasma are not really known, but there are some factors that are that makes a person more prone to get melasma. So, for example, there is something like a genetic background, like if somebody in your family having melasma, then there is very high chance that you also are going to have melasma in future. So it's also related to some hormone up and downs in the body, like women tend to get more melasma patches during pregnancy or during menopausal changes in the body. So sometimes melasma can also happen when you are on medications that are particularly photosensitizing. That is, that makes your skin more sensitive to light, like especially oral contraceptive pills or anti-epileptic medications like phenytoin. So these can make your skin more sensitive to light, and thereby you may end up having melasma like patches. So these are the causes known, like for melasma.
Doctor, are there any symptoms or signs? I mean, how would we understand that whatever is happening on our skin is related to hyperpigmentation or is melasma?
So many times melasma is symptomless. That is, it doesn't produce any kind of itch or it doesn't burn or anything. So most often that is the first sign that you are getting symptomless patch. That is a black patch without any known reason. Like for example, you are having a pimple and you end up having a black patch. That's quite common. But without any reason, that there is no obvious abnormality, but you're still getting a patch that is black, especially on the cheeks, that starts and slowly spreading throughout the face, then that's something you need to understand that it is melasma.
Okay. We have also seen during pregnancy, a lot of women go through or develop melasma. Why it happens, doctor?
So melasma is very closely related to a lot of hormonal up and downs in your body. So the very natural hormonal state that happens in life is usually pregnancy. So wherein the body is going through a lot of hormone up and downs, especially a lot of estrogen. A particular type of estrogen is more when you're pregnant, when a woman is pregnant. So this, the hormone that makes your skin again sensitive to light. So you start getting these patches on the sun exposed areas, and is, like I said, the hormone that's making you more prone to get melasma at this stage.
Right. Like we know that pregnancy is a risk factor for melasma, or we can say that genetic, those who have melasma in their family history are at risk. Is one of the risk factors. What are the other risk factors for melasma, doctor?
So the very common and most important risk factor for anybody having melasma is a chronic sun exposure, so which is unprotected, being long hours under sun for hours together without protecting your skin is a most important risk factor. So added to that, if you're having a genetic background or if you're going through some kind of hormone ups and downs, then yes, a person can have melasma when compared to other population. So chronic sun exposure is one of the most common and something that's easily missed. So sun exposure causes like a person to become more sensitive. Your melanocytes become more sensitive, and they start producing this random pigmentation on the face.
Right. Doctor, what are the most common patterns of melasma? Like we have seen few people with, melasma on their cheeks, on their nose, a few on their jawlines, etc., etc. What are the most, common melasma patterns?
So, melasma patterns basically the most common type is the one which involves your cheeks and your nose. So that's what we call it as centrofacial, that is occurring on the center of your face. But it
Mhm.
can also be sometimes on your jawline, it can happen on your eyebrows, around your mouth as well. So, it's keeping aside the site of involvement. If we take like how dark is your patch, even that also comes into account. What type of melasma you might be having. So
Mhm.
one can have dull brown patches, which is more likely to be only in the superficial layers of the skin. But one sometimes there can be some people who are having very dark patches. So this signifies that the melasma is very deep inside the skin. So
Okay.
these are types of melasmas, like depending on the color and depending on the area of involvement.
Yes, exactly. I would also like to know that what are the different stages, of melasma? Because as you said, some melasma can be, a little deeper. Some could be just superficial. So, what are the various stages of melasma, doctor?
So the various stages, or rather various types, depending on the depth of melasma, is something we call epidermal. So it means it's very superficial. It's like in the top layers of your skin. So this tends to project like a very dull brown patch. It's just like a little 3-4 shades darker than your normal skin color. But there is a type of melasma which is quite deep, that is a dermal variant of melasma, which tends to be like literally like 5-6 shades darker than the natural color of your skin. So these are the two types of melasma, epidermal and dermal. Sometimes a person can have both. Like a few areas it is very superficial and a few areas it is very deep. So it can differ from person to person.
Right. And as a doctor, how do you diagnose melasma? Is there a way, or just by clinical, investigation, you can tell that yes, this is melasma and this is the stage or type of melasma?
So many a times the diagnosis is clinical. We don't need any special tests or any other kind of modern tools for diagnosing melasma. But yes, when we want to ascertain what type of melasma a person might be having and the basic on which we can formulate our treatment, yes, we can use something called Wood's lamp examination. There can be a special tool called dermoscopy, which gives into the insight of what particular type of melasma a person is having. So depending on which we can do like explain the prognosis to the patient, and also we can formulate the treatment.
Okay, we always say in medical science, doctor, that prevention is better than cure. Can we prevent melasma?
Yes, to some extent, yes, it is possible to prevent melasma, especially when you know that somebody in the family is having melasma, or when you are on particular type of medications, like as I already discussed, like oral contraceptive pills or any kind of anti-epileptic medications. You can prevent melasma by simply taking care, like taking using a lot of good sunscreen, good amount of sunscreen, regular use of sunscreen, not thinking like I'm not outdoors or anything. So protecting your skin itself can make sure that you can prevent melasma in future.
Okay, so protecting your skin using a good quality sunscreen is what we can do to prevent melasma. How do you treat melasma, doctor? What are the treatment options available?
Well, that's a very broad aspect, so it's like a big topic to discuss. But however, I'll try to minimize. I mean, I'll try to summarize the things. So,
Right.
melasma treatment many times is just application part, like just a topical cream that your doctor will be giving you. Most of them sometimes prefer hydroquinone-based topical creams. There are doctors who prefer non-hydroquinone-based as well. To me, I prefer initially to start with a hydroquinone-based topical cream. So it is a very powerful demelanizing agent. That means it immediately restricts the melanocytes to produce any further pigmentation. So once the treatment is achieved, once the effect is achieved, then we can always shift them to a non-hydroquinone-based creams like glycolic acid, kojic acid, albuterol acid, and a lot of other things, which will help in maintain the pigmentation reduction that's achieved with hydroquinone. So sometimes, depending on the result that we are getting with the topical creams alone, we may also have to include oral tablets, maybe antioxidants or tranexamic acid, or sometimes oral carotenoids that also can be considered depending on how the patient is responding in the initial days.
Right. And doctor, how important is sunscreen in treating melasma?
So sunscreen is like the most important part of treatment of melasma. That's like non-negotiable part, if you ask me. So it's like you have to use a very good sunscreen if you want to like treat melasma, if you want to reduce the melasma, and if you want to maintain it. So all the three aspects are possible only with photoprotection, that is by using a good sunscreen.
Right. So even for prevention and for the treatment, we need to use a good sunscreen regularly, religiously. Now let's talk about sunscreen, doctor. You said that it's important to use a good quality sunscreen, something which can protect our skin. Now, when we go out to buy a sunscreen, there are so many informations on the box or the tube of the sunscreen that we are often confused, which one to go for. We would like you to tell us the basics that we should go for, especially if we have melasma in our family and we are trying to use sunscreen as a preventive measure, or in case we have melasma. I'm sure doctors do subscribe sunscreen anyways then, but still the basics to go for in sunscreens.
The basics to go for in a sunscreen is depends, like for example, you are having a hyperpigmentation disorder, then definitely you have to use something that is like an SPF more than 50. Okay, so SPF is a broader term which gives an idea how much a sunscreen is able to block any kind of UVB radiation. So secondly, there is something called PA rating. PA rating is nothing but the ability of the sunscreen to protect you from tanning. So a PA rating anywhere at least of 3 plus is recommended when you're having any hyperpigmented disorders like melasma. And also it should be a water resistant sunscreen. So if, for a person who is like out and about a lot, or if they are swimming, or if they are like sweating a lot, so the sunscreen needs to be water resistant. It's not something which should like bleed or like just go away with sweating or like water coming in contact with the skin. So on an average, it should be at least SPF 50 and more, and a PA rating of 3 plus is suggested. And these days, there are a lot of software professionals, there are a lot of desktop professionals that sit in front of your, like, the laptop monitors, continuously some light and radiation falling on their face. So for this, we also have to prescribe a sunscreen that has a blue light filter as well. So which is nothing but the light that's coming from your gadgets.
Right. Okay, so these are the basics to take care of the SPF, to take care of the boot star rating or PA plus 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 thing, and yeah, water resistance and few more other things. How important is the skin type in deciding the sunscreen, doctor? Because many a times, especially people with oily skin, will have various complaints regarding the sunscreen. They'll say that it makes my skin oily, or it makes my skin very dull, or I don't like the white cast, or it makes me sweat a lot. So there are n number of complaints they normally have. So what's your take on that?
So yes, the type of skin definitely plays a major role in choosing what type of sunscreen suits you. So anybody having acne-prone skin or oily skin should always go for like a gel-based sunscreen or a matte finish sunscreen. There are a lot of brands in the market that are matte finish these days, which won't give you that feeling of some heaviness on the skin. And yes, if you're having a dry skin or combination skin, you can also go for a lotion based sunscreen or a cream based sunscreen also. But it's all like trial and error. Like, you have to try a particular brand. I mean, just get in touch with your dermatologist. If it's not suiting you, yes, you can always change it. But choosing the right sunscreen is very important when you want to maintain your skin.
Right. So, viewers, in case you are not very sure about your skin type, please go consult your dermat. They'll help you choose the right kind of sunscreen as per your skin type and as per your working conditions, because choosing and using the right sunscreen regularly, religiously is very important. Now, we always say that, apply sunscreen before a certain time before you step out, or how much sunscreen is being applied is equally important, the amount, and the reapplication is equally important. We would like you, doctor, to shed some more light over it, how much to apply, when to reapply.
Yes. So depending, I mean, when it comes to the quantity of sunscreen that one needs to apply, there is this one study that really simplified it when it comes to the quantity of application. Previously, it used to be more like fingertip unit or a teaspoon rule and all. But now, practically going, this particular study has made it very clear that you have to use at least like 2 finger this much of sunscreen from the first crease to until here. So you have to use 2 finger lengths, which is enough for both your face as well as your neck. So whenever anybody having any kind of tanning problem, hyperpigmentation problem, your neck is also something that needs to be covered and protected. So yes, this is the rule. Like you have to use 2 finger lengths of sunscreen that's on the face as well as on your neck.
Right.
So then
And the reapplication, and yeah, yes, doctor.
So when it comes to reapplication, so many of the sunscreens these days, the best sunscreens are very water resistant. They are long wear sunscreens. So if you're completely indoors, like a desktop professional or something, you just have to reapply the sunscreen after 3-4 hours. But if you are an out and about, like you are continuously in the sun, you're a on-site engineer or something, so you have to reapply at least once in 2-3 hours.
Now, we always have the notion in our head that, right, sunscreen is to protect us from the harmful radiations emitted by the sun. But my exposure under the sun is not that much, right? I mostly stay indoors, or I work from my home, or I'm mostly inside the kitchen. But still, I'm getting those pigmentation, pigmentary problems. What's the reason why, and it becomes even more important to apply sunscreen when we are inside, doctor?
Yes. Sun exposure is one of the reasons for melasma, right? It's not the whole reason. That's the only reason. So if you are even indoors, there's a lot of visible light that's been on your face continuously. Or if you are a person indoor, but you are in an office sitting indoors, but you are in front of your laptop continuously. So there is some kind of radiation or light always falling on everybody's face. Like, for example, if I'm sitting in this place and there is a light always coming out of this window on my face continuously. So if I don't protect my skin, yes, there is a higher chances of getting pigmentation, which I don't want to take. So I will protect my skin. So the same way, heat, or when you're cooking, or when you're placed where there is a lot of heat, there's not much light, but there's a lot of heat. Yes, heat is also one of the things that can stimulate pigmentation on your face, and it can make you produce more and more pigmented patches. So sunscreen is something that can absorb the heat. A few ingredients in the sunscreen can absorb the heat as well. So hence they will protect your skin from sun, not only from sun, but the heat as well. So being indoors is not something that you are completely protected, and it's not like an assurance that you're not going to get any hyperpigmentation, pigmentation, or melasma disorders. But it is required even indoors as well to protect your skin.
Right. So, irrespective of what is your exposure under the sun, or whether you are indoor or outdoor, you need to apply sunscreen, and regular and religious application is very important. We have also heard about tinted sunscreens, doctor. Tinted sunscreens are really in trend these days. And it's also said that people who have melasma or other pigmentary, disorders, tinted sunscreens is something which is really good for them. What are these tinted sunscreens? Why is that tint is there? Is that some kind of foundation or something, or it is something else? And how it protects our skin or give us a better
So a
protection?
sunscreen can have a tint when there is an ingredient called iron oxide in it. Okay, so they mix it in different concentrations to get a various shades of sunscreens, like how there is a foundation shades. The same way there are different shades of sunscreens available these days. That's mainly because of the iron oxide, the content that's there in the sunscreen. So iron oxide is nothing but a very good physical sunscreen. It's an inorganic sunscreen that protects your skin. So in melasma, taking using tinted sunscreens have two advantages. One is there is this physical sunscreen iron oxide, which is a very good sunscreen that can protect your skin, which has advantage of making like a barrier on your skin. That's like a proper block. And the second thing is you are having melasma, people having melasma. So it's always good to have something tinted so that it makes you feel less pigmented. So yes, so tinted sunscreens are something which are really acceptable and people are very happy with this. And it has definitely edge over the regular sunscreens because of having this extra content, iron oxide in it.
Fair enough. And sunscreen is one thing, but people also use other physical barriers like hats or scarves, etc. Are they equally beneficial, doctor?
Yes, they're equally beneficial, but not like a single type. Like I not applying sunscreen and just using a like a hat or a scarf doesn't really help. So sunscreen has its role, but yes, physical means of protection also has its role. So when you are out and about, you just want to use all the means of protection that is available. So you use your sunscreen, you use your physical barrier as well. So you are protected in every way that is possible. Yes, that definitely gives you an edge than just using the sunscreen, or it definitely gives edge in just using the physical and not using the sunscreen. So combined, definitely yes, it has a wider spectrum of advantages when you're having any pigmentation disorders or otherwise also.
Right. So we can use these physical barriers as add-ons. I mean, along with our sunscreen, we can use a hat or a cap or a scarf or wide rim sunglasses, etc. Now, what happened, doctor? We all travel, right? And it's summer, so most of the time, due to summer vacations, we'll go out to beaches or to mountains. Now, when we go to beaches or for beach vacation, we do take care of keeping a sunscreen with us. But whenever we are going uphill or in the mountains, and we are like, the weather is going to be really pleasant, or we are going in the snow, we won't need a sunscreen. But then we also see a lot of pigmentary disorders or pigmentary issues after coming back from a vacation in the uphill, or those who live there. So, why it happens and how important it is to use sunscreen, even if we are up hills?
Yes, so it's a very common myth that people think that it's like very cold, then I don't need a sunscreen, or if it's very cloudy, I don't need a sunscreen. Nothing like that. So sunscreen has its role in every season and every place where you're going, especially up hills where you have mentioned like the higher altitude or a snowy area. The intensity of sun is much more when compared to a level ground or when you are in the downhill areas. So definitely the sun is going to be more harsher, so it's actually the other way around. You have to be even more concerned about photo protection when you're uphill on in an areas where there is a lot of snow. So, I mean, photo protection needs to be taken, especially in uphill areas and snowy areas, to prevent that intensity of sun affecting your skin.
Okay. Now, we often say that use sunscreen during the day or, in the morning till late in the evenings. But then there are people who go out for, night shifts, night duties, and they do work on laptops for long hours. So even during night, if somebody is working for longer durations, especially in front of a laptop or a desktop, etc., workstation, do he or she needs to apply sunscreen?
Yes, they definitely need to use a sunscreen. As long as there is exposure, as long as there is something that's falling on your face, especially the gadgets or your laptop, or you are under some kind of focus lights, if you are in some kind of parties or something, yes, you have to always protect your skin unless until you are completely like relaxed under just like a normal light at home. So at night, yes, whoever is like doing night shifts or the whole night like meetings or they're sitting in front of the desktop for long hours, yes, they need to protect their skin with a good sunscreen.
Okay. Now I'll take some of the questions that our viewers have asked. So Vandana is here asking, can sunscreen help prevent skin cancer or is it primarily for sunburn protection?
So, yes, it will prevent skin cancer in the sense it's not like general skin cancer. But if you are a person who is out and about a lot in the sun, chronic sun exposure, which in turn in future can be carcinogenic, yes, using a sunscreen can help you not have like any sunspots or sun related skin conditions that might turn into malignancy in future. But in Indians, it's quite rare to see any kind of sun-induced sun cancers. But yes, prevention is better than treatment, so it's better to use a sunscreen.
Okay. Mahira Sharma's question is, are there any bad ingredients in the sunscreen or something that we could be, allergic to? Because many of our viewers have asked this. Harshit has a similar question. Are there any potential side effects or allergic reactions associated with sunscreen use?
So yes, there are some ingredients of sunscreens that are dangerous. They are not supposed to be used, and thankfully they are not available in the market anymore. So these are banned substances. So they don't are not available in any of the sunscreens, at least we prescribe. So there's a particular compound called paraaminobenzoic acid, which was used in the past, but now it is discontinued. So most of the sunscreens these days that are available are free of all these dangerous chemicals. But answering your other question, allergies, yes, allergies can happen to any chemical, not only sunscreen, but it can happen to anything. So if a person is, we doubt that a person might be allergic to a sunscreen, then the only way of ruling it out is making them to stop a broad spectrum sunscreen that is which has both physical and chemical sunscreen, and then starting them to use only on the physical sunscreens. But allergy to sunscreens is quite rare. Nevertheless, we just have to keep an eye. Maybe if yes, a person is repeatedly coming with allergies on the face, yes, we have to also consider using physical sunscreens alone.
Okay. And initially, we were talking about how pregnant ladies are at risk of melasma. And we have seen many a times on, sunscreen, it's written that those who are pregnant or lactating should refer to their doctor before applying this. So we know that, things could be really dangerous to the lady or their kids. So how important it is to consult a doctor, a dermat, before even buying a sunscreen for a pregnant and lactating lady doctor.
So it is important to consult a dermatologist before starting any sunscreens, especially if you're planning for pregnancy or if you're already a pregnant female. For two reasons. One is, like we suggest sunscreens that are only physical sunscreens to be used during pregnancy and lactation, because there are few ingredients of sunscreens that might be absorbed into your mother's circulation and then go to the baby as well. So which have sometimes some side effects in the growing fetus or in the growing child. So for another reason is simply that we help you choose the better sunscreen. We can give you a more information if you have any other doubts regarding sunscreens. And yes, physical sunscreen is better when you're planning or pregnant or lactating.
Right. Smriti is here. She has a dry skin and she is asking for recommendation. What kind of sunscreen, what formulation will suit her?
So dry skin, always go for a cream or a lotion based sunscreen. Again, anything if it is for a regular normal use and you don't have any pigmentation disorders already, you can use just a SPF 30 sunscreen. But if you are suffering from some kind of pigmentation problem, dull skin, uneven skin tone problem, please go for a SPF 50, which is in a lotion base or a cream base.
Okay. Purvi is here asking, can sunscreen help prevent melasma from worsening or new spots from forming?
Definitely. Because sun exposure is the one very important factor for having more and more melasma. Even if your your pigmentation is under control with using some treatment, and if you don't use the sunscreen regularly, there is every chance the melasma can recur. So yes, sunscreen plays a very important role in, like I said, treatment as well as maintenance of melasma.
Okay. One more question related to skin type. Keerthi Kapoor is here asking, I have oily skin, which sunscreen should I use?
Yeah, so oily skin, you should always look for sunscreen which mentions that it is non-comedogenic. So you should not make your pores more and more clogged and have more and more acne. So always go for a non-comedogenic, water-based or a gel-based sunscreen. And you can also consider sometimes using lotion also whenever in few odd days. But yes, on an average, it's better to use a gel-based or a matte finish sunscreen, which mentions on the pack that it is non-comedogenic.
Right. Now, because Keerthi has a oily skin, and many times what happens, oily skin people are equally prone to acne, or there are people who are acne prone. Now, the thing is, while they have those acne, they'll never put sunscreen on their skin, saying that, because already my skin is troubled due to those acne, I don't want to put layers on them. But then we have seen that after acne, I mean, treating acne is one thing, doctor. It's, I think, comparatively easier than treating the scars or the pigmentation, the dark patches that they, leaves. Now, treating that becomes really tough. How important it is to use a sunscreen even when somebody is suffering from acne.
So yes, so when you have acne, the chance of you having pigmentation or post-inflammatory hyperpigmentation, that is post-acne pigmentation, happens more and more when you are not protecting your skin. So instead of layering your skin with too many things, just go with only one product in the daytime, like only sunscreen. So if you still feel that your skin is dry, then maybe from the next day you can first apply moisturizer, then the sunscreen. Otherwise, you should always stick to one product when you are having excessively oily skin. Just use a matte finish sunscreen so that whatever pimple you already have on the face, that doesn't become a very bad mark. So any inflammation of the skin, I mean any redness of the skin, so if it is not protected, it tend to leave a bigger mark when compared to a protected skin. So yes, two things: when you're having acne, don't layer it too much. Just use only one product at a time, only one sunscreen in the daytime and protect your skin. Second thing is go for matte finish sunscreen, gel-based sunscreens that will help you not having so much of pigmentation post acne.
Right. And doctor, we have also seen products, makeup products, especially with SPF, with sun protection factor. They'll have like 15%, 20% of sun protection factor. Now, many times people will ask that, do these, because I do makeup every time I go out. So do I still need a standalone sunscreen if I'm using makeup products having sun protection?
So see, many a times your foundation or the makeup generally doesn't come with an SPF, nothing like 20 or above. So it usually has anything like some 15 or 25, which is not enough for Indian skins. So you should always, maybe if your product is having SPF 30, yes, you may consider that as an alternative for sunscreen. But if it is not, then you have to definitely use a sunscreen before putting your makeup. You have to definitely have another layer of sunscreen beneath your makeup. Otherwise, you tend to get more and more tan.
What should be the order, doctor? We are mostly confused. I mean, to apply the moisturizer first or the sunscreen first, and when to apply makeup. So please clarify that a bit,
Yeah, so
perhaps.
it's just like logical because you first put the makeup and then the sunscreen, your makeup will be all over the place. So you should have to first moisturize your skin, just like let it dry completely, then put a liquid layer of sunscreen and then your makeup.
Okay. And doctor, what should be an ideal and still a very basic skincare routine for especially people who have, melasma or hyperpigmentation?
So the basic skincare routine, yes, you should use something like a very gentle cleanser. Don't go for very harsh soaps or scrubs or something to exfoliate your skin. Be very gentle with your skin. And yes, moisturizer. If your skin is dry type, if you are having a dryness of the skin, yes, first apply a moisturizer and follow it up with a good amount of sunscreen. Like how I explained, the amount should be at least your two finger tip. This one, so you have to use good amount of sunscreen and anywhere like SPF 50 and more is advised. And reapplication is suggested every once in 3 to 4 hours. Just reapply. It's not like mandatory. You have to wash your face every time you apply the sunscreen. Yes, you may dab your face with a little tissue, like if it is too oily, and then apply a second layer of sunscreen. So the daily routine should be very simple. Don't go for too many products or anything that might irritate your skin and give you more and more melasma patches.
Mhm. Right. We also have this tendency of doing a lot of home remedies, especially in case something, abnormal comes up. For example, melasma or pigmentation. Many times people also don't know that there is a term called melasma. They'll think that, okay, some pigmentation is, here, and they'll do a lot of exploitation, homemade, scrubs or put papaya, etc., extracts on their skin, etc. What's your stand on these home remedies? Are they okay to do, or we are wasting our time and equally risking our skin with all the experiments?
So see, yeah, experiments are definitely not good, especially when you're using any kind of scrubbing, even if it is just like a very pure form of basin or something. Usually, what people tend to explain me that they are doing. So yes, any kind of harsh scrubbing on the face can definitely aggravate melasma. So don't completely avoid using any kind of scrubs on the face. And second thing is like how you mentioned, like few fruits or something like papaya or there are some fruits that people like to apply on the face. One thing is they don't have any effect on melasma. They're definitely not going to treat your melasma. On top, if there are some fruits that have high concentration of acids, so if that's being used, then there is a chance that you are going to end up having more and more melasma. So home remedies, I think, are not a good option when you're having melasma. Like I said, your routine should be very simple, not too many products, not too much of experiments with your face.
Okay, doctor. And before we sum up the session, any take-home message for our viewers?
So yes, I have a take-home message. One is be very strict with your sunscreen. Could have a very good photo protection, SPF 50 and more, and follow your dermatologist's instructions very carefully, which is very important. Like how when to apply the pigmentation cream and all. Follow your doctor's advice correctly, and don't try anything by yourself trying to get rid of the melasma. Unknowingly, you might be actually making it more and more worse. And having good antioxidant rich diet also sometimes help in protecting your skin from inside. So this will be more or less what I would suggest people having melasma.
Right. So sunscreen is important. It is probably the most important thing that we need to apply on our skin. And please consult, take advice from a qualified dermatologist, because they know your skin, they know your problem, and they'll suggest you the best sunscreen and the treatment for melasma or hyperpigmentation. Take good care of yourself. Don't experiment with yourself. Don't experiment with your health. Do the right thing. Thank you so very much, Dr. Keerthi, for your valuable time. It was a very informative session for our viewers, and it was lovely hearing you. Thank you so very much.
Thank you so much. Thank you.
And viewers, thank you for your participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you. Stay spotless, stay beautiful, keep glowing. Goodbye.